Hey everyone, welcome to the Nursing Insights podcast. My name is Stephanie and I'm a registered nurse practicing in the state of New Jersey. Getting right to it, the state of healthcare right now is tough, to say the least. Let's just say that the nursing shortage does not spark joy. We can sit in that and stew in it for a while, but we can't live in it forever. Things are changing. So join me as your host as I partner with the New Jersey Collaborating Center for Nursing to hear from nurses across the state about their experiences, trials, and triumphs in the nursing profession. One of the words, I think this was a second ago, but one of the words that you brought out that I think I would love to hear you talk more about was isolation. You said that the patient experience was isolating, and now you transition this into this conversation about how you can build rapport and how you can build trust. If you have new nurses coming into the floor, how would you help shepherd them into the ability of building rapport with their patients, getting them out of that feeling of isolation?
I think the first thing is going in to see your patient, saying, hello, my name is Carly. I will be your nurse for today from 7 a.m. to 7 p.m. Is there anything that you want to bring up at this time before I start my day that's really bothering you? Giving that open-ended question and getting whatever's irritating them from the previous shift or something that's bothering them makes it go a long way. Because half the time when the doctor comes in, they're not in there for more than 5 minutes. Unfortunately, that's just the reality of it. And just by educating the patient of like, why are they NPO? Half the time, the patients do not understand why they're NPO, which means they're not allowed to eat or drink anything. They're like, I haven't eaten or drank anything in 2 days. Like, I am not going to survive. And I'm like, I promise you, you will survive. We've done this before. There is a reason. And just educating them on their disease process or why we're taking things so slowly after their abdominal surgery or different stuff like that. And a lot of times when you go on social media, a lot of people talk badly about the whiteboards in the rooms. The whiteboards is like a huge thing. I feel like that a lot of people don't utilize. So like I always put their name, I always put like a little smiley face or a little heart or something just to make it feel a little extra special. And then I put the date, the time, not the time, the date and the day of the week, along with my name, my aide's name, along with the doctor's name, because half the time the doctors just come in with their white coat and their stethoscope and the patient didn't catch their name. So it's just nice to write that down. And I always like to put their diet and just like 2 or 3 goals for that day. On my unit, we have a lot of surgical patients. So a big thing is we want them to use the incentives barometer to prevent pneumonia. So I try to re-educate them on that because unfortunately, when I'm trying to make our podcast listeners understand is they're in a room, not very pretty. It's not the goal. It's not a hotel where it's like beautiful curtains or anything. It's usually white blankets because we need to make sure we know what color drainage, if anything gets on the blankets, like there's a reason for that. And a lot of times the walls are white and just everything's white and everything's busy. There's alarms going off with call bells with patients getting out of bed. That's not supposed to be getting out of bed. Telemetry is going off. There's just so many noises and they can't just get a sense of calm most of the time. And also on my unit, a lot of them have anesthesia. So they're kind of not themselves. You need to have understanding. And also a big thing is you need to listen to your patient, not just verbally what they're saying, but you need to listen to what they're not saying. Because a lot of times they'll be telling you something and then you're like, but you're not even talking about this. Like, for example, I had one patient the other day, he had dementia at baseline. So on top of that, with the anesthesia in his system, on top of the dementia, he was out of it. Like he was just not doing well. And I remember he was just so agitated. We gave him medications to try and help him calm down and everything. And he just kept saying he couldn't tell us what he needed. So I remember when I got on shift and I'm getting a report and they're like, he's so agitated. We can't get him to calm down. We have a safety one-to-one. We have someone with him continuously 24/7. And I remember going in there and I'm trying to talk with him. I'm just trying to make sense with him. I'm like, hello, my name's Carly. Like, that's a big thing I can not reiterate any more than I can is just let them know your name. Even if you know in 2 seconds from now, they're going to forget it. Just let them know that you're here kind of thing is how I can explain it. He yelled my name the entire shift. Carly, Carly, it was like the one thing he could remember. And I remember coming back in, I'm like, hey buddy, is everything okay? And he's like, Carly. And I'm like, yes, Carly, good job, and he just like got fixated on my name, which was fine. But then his tone and his pitches changed. And it turned out he needed to go to the bathroom the whole time. And he couldn't, he was retaining. So we had to straight cath him. And after I straight cathed him, he slept. Just like little things of, they can't tell you that. You're an investigator, just like, in Scooby-Doo, you're just trying to figure out the different clues, and you're just trying to think of your ABCs and your D's and E's and F's and G's, and you just go through the line. And I really can't reiterate that once you just take a second, you just sit down for a minute, you just think about, okay, why is my patient here? How are they alert and oriented, pulmonary wise, cardiovascular wise, GI, GU, and how's their skin? Like, is there anything different than when you first started your shift kind of things? I think a lot of people get rushed and they miss little things, or just giving them graham crackers if they can have graham crackers or whatever, just like little things to let them be. That's the main thing I can really reiterate is advocating for your patient, treating your patient like family, and just trying to do everything you possibly can, because you're human, you're not going to be perfect, but just trying your best is all you can ask for.
Absolutely. And I feel like that's something that I remember I would have loved to hear as a new nurse. And I'm sure that all of the new nurses coming in would love to hear as well. And I think this also harkens back to what you were saying about, like, you're going to have 10 days and you're going to have 1 day, and you're going to have 10 days and you're going to have 2 days. And as that continues on, your confidence is going to build up, your belief in your own abilities is going to build up. And it's just going to become something where you realize a year has gone by and suddenly you're a flying nurse. Like, you are running things the way you need to. So Carly, with your transition into being a fully fledged nurse and coming through the pandemic and having all of these opportunities of both growth and, stress and triumph, were there any moments in your career so far that have really stood out to you as being a triumph, as I am here and I'm a nurse?
It's funny you say that because, it reminds me of, brides who go and see dresses and everything, and then they find the one, and then they're like, okay, I'm getting married. Like, this is becoming real. And during my nurse residency, during my first year and everything, I didn't really get that moment until probably a couple of weeks ago, maybe even a month ago, where I had a patient who was a really difficult patient, lovely man, and he had very severe comorbidities where we had to turn him a lot, and he was there for a little bit. And we had to give him IV antibiotics per the surgeon's orders. And unfortunately, a lot of times his IVs would blow, where they would infiltrate, or they were no longer viable for us to use to give him his antibiotics or any of his other medications. And there were times where we had the charge nurse go in multiple times to attempt, and they were unsuccessful. We've had the emergency room come up and try and put a IV in, and they put IVs in constantly down in the emergency room, constantly. So usually they have a very good success rate, and they had a hard time with him as well. And I remember when I was getting a report that morning, they're like, do not lose this IV. He's about to leave to go to rehab. We just need it for like 1 more day. Don't lose it. And I remember, I think it was like 1 or 2 hours before the end of my shift, I had to give him IV antibiotics. And I remember I go in there and you always flush it to check the patency, and it didn't work. I was so upset. I was like, I can't believe it. Like, I have so much to do on my bucket list of stuff to do. And I remember the patient's face. He's like, it's not working, right? I'm like, no, it's not working. And he's like, just go ahead and try it. I was like, no, I'm not doing that. There's a whole list of why we can't do that. And he's like, oh, this is not good. He's like, don't even try. He's like, I don't want you to try it. And I explained to him, like, we really need these IV antibiotics, and, this is really for your protection, for your safety. We really need this. And he's like, okay. I'm like, I'm just going to look. I'm not going to try anything. I'm not going to do it unless I feel absolutely confident it's going to work. And I remember our charge nurse a couple of days prior had a hard time putting an IV in him. And so I was like, I'm just going to look. And I remember putting his tourniquet on the one hand. I didn't see anything. I'm like, all right, I'm just going to look on your other side. He's like, okay. And he was watching TV. I did not have good hopes, and he didn't have good hopes. And I'm like, I'm just looking. And I remember I just turned his hand just the right way, and just his metacarpal, he had a vein on his finger, and it was just the most beautiful vein. And I think I gasped or something. He's like, what? And I'm like, I think I found one. He's like, really? And I'm like, I'm going to try it. And he's like, okay. And it wasn't, I don't know, you might have experienced this where, you just miss it the first time, but then you get it the second or third. I cap at 2. I stop after 2, got it the first try, and I felt $1,000,000 afterwards. And he was so happy. I started laughing. He started laughing. The charge nurse came into the room, and she was like, what's going on? Is everything okay? And I was like, I just got a 22 gauge in him first try. And she gave me a high five. And it was just so funny because it was like such a small little moment, but just realizing like, okay, I can do it. Like, I'm good. Like, I actually can do this, and it was just like a really awesome moment just between me and the patient of something where we were like, oh, this isn't good. And it turned out to be awesome. So it was just like a really good moment. And it's just really nice to have those days. And that was a 10 that day. It was something so small and so little, but it made me feel so good. And I remember going home that night and my family was like, how was your day? And I was like, it was fantastic. And they're like, what happened? And I told them, and they didn't understand the significance of it because they don't have a lot of medical background, but it just felt so good. And it's just funny that I remember it even to this day. And I probably will carry it on for the rest of my nursing career as well, which is cool. So it's just those little moments that are awesome instead of those big moments too. And no one was watching either. You know what I mean? Like, it was just me and the patient. It was just like really cool.
I mean, it's just wonderful because it's true. Not every moment comes with trumpets blaring. Some moments are just like, I did a fantastic job today. Like, I did my best and I made a difference for somebody today.
Yeah.
And I think for me, that's one of the things that made me fall in love with nursing, is knowing that when I walk out of that room, like, I have made a difference for somebody today.
Absolutely.
And that doesn't also even just limit itself to our patients. We also do that for each other. And I would love to ask, because I had, from speaking with you earlier, learned that you have been doing mentoring on your own now. You've also been precepting. Yes. Would you mind sharing with us a little bit about precepting, and also how you knew that you were ready to precept, or how you began your journey as a preceptor?
I haven't really been a preceptor in the hospital. I would say I helped 2 or 3 nurses in regards to being charting wise. That's kind of one of my strengths, is charting and finding where things are on the computer. And I personally might not know the answer, but what cracks me up is I have a lot of nurses that come up to me and they're like, where do I find this? Because they know I know where to find it. So it just like cracks me up because I help, I guess, in that way. I do more like mentoring and precepting in regards to actually my disability in a way. I am bilaterally deaf, and both ears I wear bilateral cochlear implants. So I do a lot of precepting and mentoring in regards to that, with talking to parents of newly diagnosed children with a hearing loss of, what are the next steps, that sense of doom of like, oh my gosh, my child is deaf. This is the end of the world. And just having them speak with me and with my parents and just telling them my story of, I'm able to do what I'm able to do. I was able to chase my dreams. Nothing held me back. It was definitely a rocky road, but definitely in that aspect, I did a lot of mentoring and precepting in that route. And it's kind of funny you say that, because I know this is kind of like a little off left field, but we sometimes have patients who have a hearing loss that come into the hospital. And it's funny because who do they assign those patients to? They assign them to me. And it cracks me up because I remind my coworkers, I'm like, listen, you're correct. I am deaf. They're deaf, but they use sign language. I don't use sign language. So I am still in the same space as you as with them, but I'm more than happy to take them. And it's great because I don't know if it's because of my sense of awareness with the ADA, the American Disability Act, and understanding what their rights are and advocating for them, because sometimes we have some patients that would prefer to have a human interpreter rather than a visual iPad interpreter, and just making sure that the hospital and everybody, including the doctors, are using the human interpreter. And not just only, you don't face the interpreter, you face the patient. patient just like they're having a conversation with you, and just making sure they realize that. So it's just education wise for everybody. I would be more than happy to precept in the hospital, but I personally don't feel ready just yet to be a preceptor. I did get asked once and I did it, but then I remembered afterwards, I was like, I don't think I gave as much knowledge, as much information as I could have probably done as somebody else with more experience. And just being aware of your strengths and weaknesses is a huge thing, especially as a nurse, is understanding, okay, I'm not good at this. Do you mind coming in the room with me? You know, there's some people that we have one nurse who, for some odd reason, she's been a nurse, I think, for 7 years. She has never missed a Foley catheter in a female. Anatomically, sometimes females are really hard to get a Foley catheter in. For some odd reason, kudos to her, she's able to get it in every single time. And especially after these type of surgeries where just things anatomically, or even having children, women just anatomically are different. And so I remember one time we had a nurse like, I didn't get it in. Like, we're screwed. Like, that's just the end of it. I was like, hold up. I just want to introduce you to someone who we are very fortunate to have on the unit today. For some odd reason, I don't believe in coincidences. Like, everything happens for a reason. I'm like, you need to go talk to her. She's been 10 out of 10 with every time she's put it in. Why don't you go talk to her, have her come in the room with you? And she's like, okay. So I remember the two of them were conversing about, you know, what are her little tips and tricks. And then they went in together and the nurse came out and she's like, I got it in. And it was just like really cool. Just realizing like some people are just really good at putting IVs in. Some people are really good at their charting. Some people are really good at NG2 placement. Some people are really good about just knowing, hey, something's off. Even though there's no signs or symptoms just yet, they're like, there's something off. And lo and behold, something happens and they were able to get on it. So just knowing who you can go to just makes your life so much easier and makes your shift go so much smoother, especially when there's a lot of choppy water going on. Realizing you're not an island is number one. And realizing, yes, you're the nurse for that patient, but you have all these other nurses that are taking care of patients as well that can be able to help you out. So right now our hospital is trying to transition from double rooms to single rooms. So it cracks me up because we'll have some patients where we'll have a patient in a single room and I'll think in the back of my head and I'll even bring it up to our charge nurse. And I'm like, I think they need to be in a double room. I know they don't want to be, but just having someone who has the same diagnosis as them and seeing how well they're doing will make them realize, oh, I can do it too. So sometimes that works, sometimes that doesn't. So it's just knowing, trying different things, just going to your different resources. And especially on nights, a lot of new nurses start on nights, you know, that's quote unquote the rite of passage, I guess you can call it. And I started on nights and I learned so much because unfortunately on nights, there's less resources, there's less people. But Hunterdon was really fortunate and did a really good thing of developing the resource nurse. So it's just really nice just being one phone call away of someone who's on, who works and has been doing this for years and just being, this is what's happening. What do you think? What should I do? And they know their resources. And it's just really cool just to be able to talk to them. And they're like, actually, I don't know the answer to that, but hold on. And they'll call someone who's on a different unit or whatever, and they'll explain the scenario. And it's just awesome because everyone has that goal in mind of the patient's first. We're advocating for the patient. And unfortunately, when things go wrong, it's not going to happen between 9 a.m. and 5 p.m. like a regular job. It can happen at any time.
I mean, having that network, having those support systems, having your residency and all the people, the mentors that have been a part of this journey with you, I think that's just something that you also just don't get in other professions. Like having these people who are with you through the thick and thin, like that is just such an amazing aspect of being a nurse and through your journey that you've been sharing with us. Have you been able to stay in contact with your other cohort members from your residency and other nurses throughout the hospital as well?
Absolutely. So floating happens after a while. So what happens is the nurse supervisor of the hospital who sees the staffing ratios of the whole hospital will see, okay, you guys only have 16 patients. You guys have 5 nurses. You don't need 5 nurses. Really, you only need 4 nurses. So you have that extra nurse. But I see over here on this other unit, they have 25 patients, but they only have 4 nurses. Let's move that nurse over to that other unit to help them out. And it's really scary as a brand new nurse to be told, hey, congratulations, you are floating, and they say it in like a little bit of a sarcastic way, but it's a good thing. It's a really endearing thing, I truly believe, because you're continuously learning. You get a little comfortable on your unit where you're like, where everything is and everything, and they make you wait, obviously, till they feel you're safe and you feel like you're more confident because you know where your resources are. So once they have you say, hey, you're floating, it's your turn, it's really scary. And it's in the same building, but everything's placed differently. And they just have a different vibe sometimes on different units. One unit's just a little bit quicker paced, and then other units they just have a different flow, where huddle is at a different time. Their clean utility and their dirty utility rooms are a little bit different, or just the layout of the unit is different. You're kind of in square one sometimes when you're on these units, and just being able to advocate for yourself to be like, hey, I'm helping you guys out. I need you to help me out. I need to know where this is. This is my assignment. I see I have 1, 2, 5, and 6 or whatever. Can you show me where these rooms are so that, can you introduce me to the nurse that had them during the day shift or night shift or whatever time you're coming on, and just realizing, okay, you just need to take things a little bit slower. So at least it's the same computer system. So at least that's good. Just realizing like, okay, the layout is a lot different. The med rooms are different. My patient, we have one unit, 3 West. It's huge. I think it can have like 40 patients. Whereas my unit, we only host about, on average, we'll usually have 15 to 20, at most maybe 25 patients at once. So it's a whole different vibe because it's so much bigger. The hallways are a lot longer. I'm not used to this. Being able to go with the flow, being like, okay, I can do this. Just giving yourself little mantras of everything's going to be okay. This. It's just a little bit of a different atmosphere, but it's the same concept, the same rules. Your shift ends in 12 hours. What can you do to help your patient in those 12 hours? It's a whirlwind. I always give my new nurses, a little hug or a little like, you got this, you can do this. The other night, we had one nurse who just went over to another unit for the first time. And she looked at me, she looked terrified. And I felt so bad for her. I was like, you're going to be okay. I took her phone number. I'm like, listen, I'm going to text you my phone number. If you don't feel comfortable talking to one of those nurses, I'm really strongly against that. I really recommend talking to them. But if you have any questions, please do not hesitate to text me. And I remember while she was walking over there, I called that unit and I said, hey, you guys are getting a float, but I want you guys to make sure you realize this is her first time. And she's probably not going to tell you, but this is her first time. I just need you guys to give her a little extra cushion. And she came back later that day to clock out. And she's like, I had the best time. And I was like, see, it worked out. And it just like cracks me up. She didn't have to text me. She didn't have to do anything. She's like, I found 2 people and they helped me out in what I needed. And I knew they showed me where to get everything and it worked out. And just realizing some things are out of your control. There's nothing you can do about it other than just take it with a grain of salt and take it with some grace. Take the experience as it is, because you're going to learn a lot more from it if you take it head on than just being and complaining about it the whole time. You're not going to gain anything from it. So I really truly believe in everything happens for a reason, and you're going to learn something from it, whether you realize it then and now, or you realize it weeks later on when you're like, oh yeah, I did that the other week on the other unit, and this is what they did. I'm going to incorporate it on this unit kind of thing. So it's kind of cool stuff.
I don't want to let that moment slip by, because I want to just like congratulate you and thank you for that act of kindness you had for that new nurse. I mean, doing something as simple as calling another unit, like maybe it doesn't seem like that, like all you did was pick up a phone, but the act of grace that you gave her by reaching out and helping her transition is just such like, you are wonderful. You're a wonderful person. I'd be happy to have you on my unit anytime. I mean, what a great act of compassion. Yeah. And I think that the recurring theme is like having compassion for yourself, having confidence in yourself, having compassion for the people around you, your patients, your coworkers as well. So thank you, Carly, for doing that for her.
Absolutely. No, it's a rough field. It's tough. It really is. And you really need to hold each other accountable and really keep each other close and really, yes, you're struggling, you're trying to survive. You need to be aware that you're a team. And just because you're not taking care of that patient, she's a team member of yours. And if she's struggling, you need to be able to go out and reach out to them, because half the time I know there's nurses or people in general that do not want to ask for help. They are more than happy to struggle in silence, and it's not okay. And we need to change that dynamic, and we need to change a lot of things, because there's a lot of people that are really good nurses that leave the profession. And there's a lot of new nurses that just haven't reached their potential yet, that leave too early because they didn't feel that sense of home or that sense of welcome, and just being that little person on the side, on the other side of the unit, or even just moving your computer next to their computer and just being like, hey, how's things going? Or just sending them a text ahead of time. When I used to drink Starbucks, I would look up on our timesheet of like, okay, who's working with me tonight? And I would send a group chat sometimes and be like, hey, I'm going to Starbucks. Does anybody want me to bring anything in? Just bringing that sense of camaraderie and that team aspect really goes a long way. And I really can't stress that enough. It's a huge thing. And there's going to be good days and bad days. Like I said before, there's going to be days where I'm in a bad mood, and there's going to be days where other people are in a bad mood. It reminds me of when people talk about relationships, it should be 50-50. Relationships are not 50-50. It doesn't exist. Some people are like, hey, I'm really low today. I'm at 20. So then your partner's going to be at an 80, 80%. They're going to cover that 100%. That's kind of the same way of how the nurses are. You're going to experience death. You're going to experience a lot of sadness and a lot of hurt, but you're also going to experience these wonderful things that happen where you save someone's life. And it's just this most miraculous thing ever. And it's just like this most beautiful thing. And you don't realize how close you are with somebody until later on, when you're like, we experienced that together. And a lot of times after COVID, a lot of people don't talk about it. I don't talk about it, but I really should, is we went through a lot of dark stuff together, and we need to come together and realize we went through it all together and we made it in the end. And we need to keep going, because it's not going to stop. There's people out there that need us, and we were willing enough to apply to nursing school and say, I am ready to help patients. Every person that goes to nursing school, they ask you in the application process, why do you want to become a nurse? And, you try to be a little different and try to be unique, but ultimately everyone's same answer is, I want to help people. And just realizing you came to nursing because you want to help people, no matter how mean or how nice or how sick or any of that stuff is. And I love learning. So I really try to incorporate, what am I going to learn today? And that might be a different thing for somebody else. So just realizing what your reason is, and just reminding yourself what that is before you go in and walk through the doors of the hospital, and clocking in and saying, what's next? Nursing is a really awesome field, and I can't wait to see where it takes me tomorrow, next year, 5 years from now, because I know it's not just in the hospital. You can go anywhere with it. And that's something I didn't realize until I went into nursing school. There's a whole world to it that it's like the tip of the iceberg.
I cannot agree with you more. I love nursing, and I am so proud and passionate of the for the profession. As a wrap up note, because I feel like there's nothing else we could do to top what you just said. I feel like I got goosebumps listening to you. Aww. For people who are in nursing school, people who are in those trenches right now, people who are facing those kind of one days, many 2 times in a row, or for people who are looking at being a nurse and who maybe have their own loss of hearing or their own disability that they're considering, can I do this? Do you have any last parting words of advice or thoughts for them?
I think just taking it one day at a time and just doing one more, and just realizing you're human. We've talked about this, just realizing you're human, you're not perfect. That's really all I could say, is just trying it and just keep going, and just waking up the next morning and starting with a clean slate. That's all you can do. And just keep reaching out to other people, because you're not alone. I cannot reiterate that enough. You are not alone. There is someone out there that can help you, whether you realize it or not. And you just have to look around the corner, and they will be right there.
Absolutely. Those people, as we've said, these are coworkers, these are mentors, these are nurse leaders, these are resource nurses, these are people that have the formal background to teach. Absolutely. And then people who are there on the floor next to you. Like Absolutely. There's a whole community surrounding. So thank you so much, Carly, for bringing that point back to us. Thank you for joining us on the podcast, and we'll see you all next time.
Thanks for listening, everyone. We'll see you next time on the Nursing Insights podcast.
This podcast is brought to you by the New Jersey Collaborating Center for Nursing and the Rutgers School of Communication and Information.